Welcome to Stand Up for Doctors. I'm your host, 𝗏𝗵. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience, and I would like to announce that my episodes are being uploaded to Spotify as we speak. So 70 are up so far, so feel free to find these episodes on YouTube and Spotify. And today I would like to welcome Dr. Sarah Hollander and 𝗏𝗏𝗆𝗆. Thanks for joining us today, Sarah and Kelly.
Thank you so much, Kim. I'm so excited to be here. I love the work that you do, and I'm just so appreciative of what you've brought to the whole medical community and beyond. We're so appreciative.
I agree, and thank you for allowing me to be part of this discussion today.
Well, thank you. And I've had such great conversations with each of you, and I'm really looking forward to this. And by way of a very brief introduction, Dr. Sarah Hollander is a holistic psychiatrist and the founder of Psychiatry of Life. And Dr. 𝗏𝗏𝗆𝗆𝗆 has a PhD, is a clinical health psychologist, and she's a speaker, consultant, and author. And today we'll be talking about how I was fortunate to meet Kelly at the Dr. Lorna Breen Heroes Foundation Healthcare Worker Wellbeing Day. That's a mouthful in DC in March, where she was an excellent presenter. I loved your talk. And Kelly helps healthcare professionals and leaders co-create a culture of well-being. And that resonates with Sarah, who would share with me, we must improve the culture of medicine starting in medical school. And the question that I'll pose to each of you will be, how would you each suggest we begin implementing these necessary changes? And in the context of joy, I love that. We're looking to move forward in a positive way. So I think that's really important. How I start, though, is I always ask what you'd most like our audience to know about you. And Sarah, would you like to go first?
Oh, sure. So I would love people to know that my approach to psychiatry is a holistic one. And that means that it's a philosophy, really. It doesn't mean that I see symptoms, it just means that I see the entire whole person in front of me. And that means that I look at all these different factors, whether that's biological, sociological, psychological, but also existential. And I see that as a huge factor that is sometimes missing. And I really like to bring that into my work. I also really love humor and singing and dancing. And sometimes I laugh at my own jokes.
Well, that is fantastic, and I find that to be true myself. And you'll have to catch the episode that I just published this Monday with my own gynecology oncologist, who is the lead singer of a band with, have you already seen it? With an
Not yet.
orthopedic surgeon who is also in international ballroom dancing. So we've got some singing and dancing going on in that episode, and you'll love to check it out. And Kelly, what would you like us to know about you?
Yeah, I think I really want people to know that I see joy not just as a mood, but as a value. And I try to intertwine it into not just how I live my life, but how I do my work. And one of my joys, part of my passion, it's an ingrained and um, a deep part of my life is aiding folks in living the most healthy and well and mentally healthy lives that they can. So it really brings me joy to be able to connect people with others, connect people with resources, and aid people with connecting them with skills and even just self-reflection that aids them in making the changes that creates their own spark in their life and possibly being able to cultivate joy within their own lives. So I'd like people to know that about me.
Well, I love that. And so we all have some synergy. You can see why I had us on together today. And I like people to share a powerful story. What is your why in doing this work? And Sarah, would you like to go first again?
Sure. So for me, mine always comes from like the root. right? So even for me, what's my root? What the why comes from very at the beginning, which was I was always very, very naturally curious about people. I was always questioning, I was always asking, why this, why that? And I was surrounded by a lot of people. I learned very early on that people don't just survive pain, they carry it as part of their lives, sometimes silently. But I also could read between the lines, and it was something that I picked up on very early. And it was something that I really wanted to expose and understand. And the people that I also was around, despite their hardships, also chose to live through joy and gratitude. And that was also something that I often asked, like, how did you get through all of that? How did you explain any of that? How did you give meaning to all of that? And I think that's a lot of why I bring what I do to my work now and why that's so important to me and my own life.
Right, and that's a great question to ask, and I've had to ask myself that multiple times over the last few years. So thank you for sharing that. And Kelly, share a story with us.
Yeah, the story I want to share has to do with how I got into the work of helping healthcare providers. I was already leading an office where we were taking care of the mental health of medical students. And I had a number of medical students with that I was supporting who had depressive symptoms, anxiety symptoms, some post-traumatic stress disorder, but a few students in particular who were living with some chronic suicidal thoughts and those kinds of things. And while they were getting lots of support, I ended up having a conversation with a faculty member once. And this faculty member had learned, because the student had been vulnerable enough to share about some of the chronic suicidality that they have experienced over their lifetime. And I ended up having this conversation with a faculty member, and the faculty member was very distressed. They weren't quite sure what we needed to do for the student, if they needed to have time off, what were we going to do about this? And the conversation we had, I had to explain to the faculty member that there are some folks who live with chronic suicidality. And this does not mean that they're at risk at every moment of every day, that they can lead wonderful and beautiful whole lives, making sure that they're accessing the support they need when they need it, how they need it. And it really made me think a lot about the influence that maybe I could have within healthcare and medical culture because we have full human beings coming to do this work. And sometimes there's this thought that there can't be any sight of flaw or carry any long-term things that from the outset or if you share look like damage. And we know this is not the case at all. And so, in having this conversation with a faculty member, being able to advocate for students and the support that they need, and them being able to continue and thrive and move forward within medical school, it has really brought me joy to help see folks in healthcare be able to be seen as full human beings instead of this caricature of a superhuman or a superhero. Because true connection really comes when two human beings sit down and work together. And in their humanity, as I'm a psychologist, but for physicians to be able to come into the room as a provider with their full humanity, I believe actually increases their ability to really touch the souls of another person in their care. And so this small story is part of why I love the work that I do and why I do some of the work that I do.
Well, and that is critically important, and we need to change the narrative. And every single conversation we have makes a difference, right? We need to chip away at the stigma. And as our work with the Dr. Lorna Breen Heroes Foundation continues, and they want to remove those intrusive questions to make seeking mental health support accessible to all doctors and nurses and pharmacists, and without stigma attached. And I love what Dr. Joe Sherman said. I had him, he was one of my first guests. And he said, if they have that question on the back, have you ever sought help for mental health support? He goes right under it. It should say, and if not, why not? Right? Like you all do hard things. It should be understandable that you should need support and ask for support and be able to access that without any repercussions at all. So, Sarah, anything you'd like to speak to what Kelly or I just said? And then you could continue on into how do you suggest we begin implementing these necessary changes?
Mhm. Sure. I love what Kelly mentioned. Your story is beautiful. I can just see how much meaning and fulfillment you derive from what you do. And that really shows. And I just love when people come to the forefront leading with that. It really is felt. And because of that, that authenticity for what you do and it's real for you lives in your nervous system. So it doesn't really matter what you do, it's just emanating from you. And leaders like you are so needed in this space. So I'm so appreciative also for what you do and what you bring to the table in a real, authentic way. That being said, that kind of carries into my next point, which is emotional intelligence, learning about yourself. That doesn't end, but I would really love it if it became a part of the medical school training as a requirement. Understanding yourself. So we used to have a class called the Art in Medicine, which I loved. It was all about how to ask questions, how to be with the patient, how to, and you actually had a chance to videotape yourself, and you really get a chance to get to know all these kind of funny quirks that you wouldn't know otherwise. And I loved that aspect of it because there is so much art in medicine. But the other part of the art in medicine is what you bring to the table as a person, as a human. And I would love to tap into that much, much more early on so that students have a chance to really think about why they're choosing medicine and why they choose the field that they end up choosing to go into, which is also very important. And having the emotional intelligence, recognizing some early stressors early on, catching them then can really set themselves up for a lot more success later on.
Hmm. So I've heard about the art in medicine. Now that's not universal, right?
I
Okay.
don't think so. That was something that my program did, which I loved. It was about how to speak with different types of people.
Right, I love that. So Kelly, if you've had experience with that in the organizations that you've worked in, if you would like to speak to that, and also what you think we could be doing to improve the culture of medicine starting in medical school.
Yeah, I really like what you just shared because I think programs like that aid students in just seeing the world a little bit differently and also seeing themselves in different ways. There is something about medicine or any career where you're having intense interactions with other people that you don't know that the impact those interactions are going to have on you. And so anything that can be done to help you be self-reflective about who you are and see how you see yourself in a variety of situations really just helps with that personal development and the development of becoming a physician. I also see, a role for making sure that there's opportunities for students to have conversations about mental health, even
Mhm.
if they've never had a mental illness or had symptoms in the past. Being able to have these conversations ahead of the game so that they can know how they might take care of themselves should something happen that makes their mental health much more difficult to care for or scratches away at their mental health. We know, or in my experience, most people look away or just say, well, that's not for me. I've never had any problems with that. That hasn't been mine, so I'm not going to pay attention to it. And not realizing that a lot of things, and Dr. Hollander, I'd love for you to jump in, but as a psychologist, at the way I see it is a lot of things that happen in medicine are not things we ask everyday folks to expose themselves to. And so you have no idea how that's going to impact you until you are having dealing with that thing over and over and over again, that you are in constantly in a situation that the person you're supporting is the worst day of their life on a regular basis. What do you do with that? How do you build your ability to support your patients and support yourself in the face of constant difficulty? And I think that comes with there's support that's needed to be able to do that. I think medicine is a beautiful and admirable career. And one of the reasons why I love that I get to support physicians and other healthcare workers because I want to see them thrive. We need them so much. And at the same time, early in training in medical school, setting folks up to say, at this moment, you might not think these resources are for you, but they may be for you at some point, and we want to make sure you get exposed to them so that it's easy for you to reach out or raise your hand when things change for you or they look different because of the demands that we're asking of you.
Yeah, so to speak to that, I recently had on a doctor who is in long-term recovery, and he's an anesthesiologist. And one of the chapters in our book, White Coats, Courageous Hearts, is by a retired anesthesiologist, and his chapter is substance use disorder and anesthesiologists, highlighting risk for all doctors. So before he submitted that chapter, that was not on my radar at all. So when I had this anesthesiologist on, and I said that it should almost be like a warning on a pack of cigarettes, that if you're an anesthesiologist, how at risk you are because you're with these substances like all day, every day, and there's the stress and all of that. And I asked him in the episode, I said, do you have like a class or a training on that? And he said, like, they watch one film. But exactly to your point, Kelly, when he watched that film, he was just maybe a new resident, knowing he's going to do anesthesiology. And he's thinking, well, that doesn't apply to me. So it didn't register. So when he started having these stressors and things came up, exactly to your point, he didn't have a toolkit. He didn't have resources or the bandwidth to access those support. And he ended up obviously going through a very challenging time. So what you're saying is critical, Kelly. Sarah, what should we be doing?
I think that community is huge. So, what do I mean? Community amongst medical students, community amongst other residents, whether that's upperclassmen or the same, and being able to have those conversations with each other to know that you're not alone and that what you're experiencing or what you might experience doesn't mean that it's necessarily going to happen. But what are some of the warning signs for you to notice in your classmate or in someone else or in yourself?
Mm-hmm.
And that really just needs to be an okay thing to talk about. It doesn't necessarily need to be something that you discuss with everybody, but amongst each other in a maybe safer environment where you feel like you're not so exposed. All of that is okay. And not just okay, but almost expected that you're going to struggle. And everybody's looks different, but that's okay. And you speaking up might actually help someone else. So speak up because we can all learn from each other. Otherwise, we don't know.
For sure. So my next question is about responsibility and who owns the responsibility for this, because I'm also starting to interview healthcare leaders, and I feel like healthcare leaders have a responsibility for the culture of their organization and the culture of their team, right? To be caring leaders and to care, but of course they have to care for themselves or they don't have the bandwidth then to care for the people who work for them. So you could also say that extends to med school and residency programs, and who is responsible for that, because I think some med schools might say, well, our curriculum is so intense, we don't have time for any of that. So Kelly, who works with med students, and Sarah, who not all that long ago was a med student, if Kelly could go first, if you could each speak to that.
Yeah, I think it's always been in the roles that I've been in medical schools, a challenge around what goes in the curriculum, what's outside of the curriculum, what needs to be part of it. I honestly believe that these conversations need to be embedded in the curriculum in some ways. And even if it is simply exactly what you just said, Kim. This idea that our faculty, everyone who's teaching our medical students, that we ensure that they're able to take good care of themselves so that when they are teaching a class, there's always side comments. Could the side comments be, oh, I made sure I took care of this? And in my therapy appointment last week, or by the way, when I made sure I reviewed
Yeah.
facts about substance use and
Mhm.
challenges around mental health, I just review those resources and documents on a regular basis so that I can have them for myself or for colleagues. Even if it's at minimum, just having faculty say those things because they're actually doing those things for themselves, it would have a profound impact on the culture and students being able to say, wait a minute, maybe these are conversations we need to have among ourselves, and maybe the things we can do for ourselves. It is again challenging because sometimes when we embed things in the curriculum or make certain things mandatory, when students don't fundamentally see it as important for them or don't say, well, how does this apply to me right now? Oftentimes we offer things and no one's really paying attention because they can't see the benefit for themselves. So there is this challenge of figuring out how do we bring it and how do we present it in a way to make sure folks know this is about you and this is to support you, but doing it in a way that's mindful of all the other needs of the curriculum. So I think it's something worth taking the time to figure out. And I do believe those who are in charge of medical education, this is on their plate of things to do. I believe it rests with them to really grapple with how do we get this done?
Right. And then even planting the seeds, because like you're saying, if someone is in a good place now and they're like, oh, that doesn't apply to me, if the seeds have been planted and if they have the resources that they could think back, oh, well, I remember this teacher said this, or oh, they gave me this, list of resources that they could draw on that. But if it's never been presented before, because then I know Dr. 𝗵𝗔𝗵 has shared when you're feeling really low, even reaching out for help can seem like too much work.
Yeah.
So, but if you've already have the resources or remember that they were offered, it's something you could draw on. And again, exactly speaking to what you're saying about faculty being able to stand up and share these things themselves. I was actually asked to present at a college in New Jersey last week and do a book signing. And so I shared my story. I had cancer 3 times. One of my doctors took his own life, and I felt a calling to support doctors. And after the presentation, one of the faculty raised his hand and he said he had a relative take his own life. And he just said we had no idea. And he was saying how important it is to have these conversations. And I was told that after our discussion, that some of the students like approached him and got to start these conversations. So as to begin to what could we do? Last week, we did it, right? We did it one time. So, Sarah, what would you have to say, like, if medical colleges think or residency programs, oh, we don't have time to put that in the curriculum?
I think it's multiple fold. There is a top-down approach, and it's also on an individual level. It's both. The top-down, they need to understand it's actually worse and culturally worse if you don't do it. That prevention is extremely important, and how much damage if you don't work on it and focus on it. And it ripples. There's a domino effect. If your program is a place that has culture for learning and growth and being able to express yourself, you're going to learn more, you're going to be better, and you're going to do better.
Mhm.
I don't see why that's not part of the curriculum. And also, you have your own responsibility for yourself to know your boundaries, take care of yourself, know what's important to you, know your limits, and take care of yourself. And if you don't have those skills, again, part of that education is recognizing, oh, maybe I should start doing something about it now. Because prevention is so much better than, just like you said, sometimes you get too far down and you're like, I can't ask, I'm afraid to ask. And that's part of the other thing where I noticed a lot of students or um, residents weren't speaking out because they were afraid
Right.
that if they did, what would happen? How would they be looked at? Would they, those kinds of things. And destigmatizing. So just like you said, Kelly, in such a beautiful way, if other people, other teachers are talking about it from the top,
Mhm.
that also implicitly creates a culture of this is also okay and we're here.
Mhm. I love that and how you're saying it is a system responsibility and an individual responsibility. So also when we're talking about healthcare systems, we need to say we need caring leaders. They need to have some responsibility, but individuals do also because some doctors don't like the word burnout because they say, well, it's a system issue. If there weren't so many problems with the system, I wouldn't be burnt out. And that may be true, but there still are things you can do to shore yourself up now, right? Whether it's working part-time, whether it's seeking help for your mental health, whether it's making sure you make time for a hobby, right? That there are things you can do. So it is important to spotlight that as well as it's a dual responsibility. Do each of you have any suggestions? And Kelly, you could go first. Anyone listening or us, like if we wanted med schools and residencies to get this message, like how could we make this a broader message? What could we do?
That's such a good question. I think I mean this really does need to be a an important topic and needs to come up a lot. Um, I can't help but continue to think about the things that both of you all said just now about systems versus individual. And there is something, I believe it's Dr. Brian Sexton says, really that yes, there are systems issues, but to not talk about what happens on the individual level neglects this idea that after the impact of the system, it's left some long-term damage to individuals. So while we're cleaning up the system, even if the system were perfect, the damage has already been done to individuals. So we do have some individual work we have to do because of the impact from the system. And so, because of that, our medical schools really do have a job to figure out how do we embed well-being at in the ways in which we teach medicine, and how do we also give folks access to the tools and skills they'll need as they're becoming a physician in training or and beyond, but also encouraging folks to dig deep because as an individual, you also have a responsibility to yourself. And systems can't figure out what we need as individuals. As individuals, we really do have to be reflective because we can get all the tools and resources, but only as an individual can I decide this is what works really well for me. This is the way in which it works well for me. And this is how I sustain the goodness that I have taken from my resources and tools over time. Those are the things we have to figure out for ourselves. So.
Yeah, absolutely to that. And then hopefully everyone who hears this episode will think about, well, who could I tell? Right. And we have to start getting the message out and having these conversations. You're right, like, repeatedly and in
Yeah.
different situations and organizations. And Sarah, what would you like to add? And also, do you have any suggestions about like what has helped you get through challenging times?
Mhm. Sure. So I want to, the first question, what came to mind was, you think about companies, big tech companies, and they have all these well-being retreats and people who come in and they have found a way because, let's face it, it helps with results, doesn't it?
Hmm.
Because it enhances creativity, it enhances togetherness, it enhances all these different things. I don't see how that's any different from medical school or residency and beyond. If you catch it early and you enforce this, it's again going to be a domino effect. Mentorship with other residents or other programs like that, like whether that's through the AMA or let's say you're in family medicine, you want to do AAFP or the American Psychiatric Association, connecting them students young with somebody who's been in the field for a longer period of time is also a nice way to connect and have someone that you can talk to every now and again and actually just have a conversation that's beyond the program itself. They might feel safer doing that in the beginning until it becomes something that's part of the system naturally. So kind of like a stepping stone
Yeah.
until I think it becomes part of the curriculum, just like I mentioned with the art and medicine, just naturally letting that be a big piece throughout the year. It can be, it's like a slice of bread. You take a little bit at a time until you get the whole loaf. What have I leaned on? Oh boy. I've leaned on gratitude, joy, and really being honest with myself. That's the hard part. Really, truly being like digging deep, being honest with yourself. I do this with my patients. I'm like, we didn't come here to play small and we're not here to be superficial. We're here to really get in here. And I do that with myself. I can, right? And that's for me to be fully alive. And if I can be honest with myself about what I need to work on and what my strengths are, that's the best place to start. And then working from there. I'm not afraid to ask for help. I'm not afraid to say, you know what, I'm not sure. I'll check that out. And being humble, always coming at it from a beginner's mindset, always knowing that there's place for growth, um, and setting yourself around the people who are good for you.
Hmm.
That is huge. Your community matters so much. If you're around people who drain you versus lift you up, that makes a huge difference. If you're around people who work with joy and gratitude and life, let that be the people that you are around. So I hope a lot of those different things ring true for others.
Yes, I think that's great. And also, I think it does help to spotlight what they'll get out of it as far as the organization or the med school or the residency program, because organizations are more likely to implement some caring leadership solutions if they see how it'll impact their bottom line. So, to speaking to med schools and residencies, if we can see how it would impact their bottom line or the success of the organization. Yeah. So I hate the fact that we have to wind down. Kelly, would you like to share anything? What has helped you overcome challenges and what brings you joy and how our listeners can get in touch with you all at once?
All at once. I'll sum them up. Um, as a human being, I often, when I have challenges, sometimes I forget that I have overcome other obstacles in the past. I can quickly be like, what in the world? What is happening to me? And so it can take a moment for me to reset and say, wait a minute. While I might not have been here before, I've overcome something else before and dig into strategies that I've used. My faith is big for me. And so digging into faith and prayer and fellowship with friends, I've got this friend group chat. It kind of anchors me and supports me. But most of all, I believe my life has meaning. I believe everyone's life has meaning. And because of that, I can move forward because I know that there is purpose for my life. And knowing that there's purpose really changes the lens of whatever I'm experiencing. I've most recently started asking myself, what is life asking of me in this situation? And it allows me to anchor myself and then move forward with grace, knowing that I'm not just doing something for myself, but I have something to offer the world. And sometimes the thing that I have to offer the world is just me taking good care of myself. Sometimes that is enough. And when I can remind myself that I have a ripple effect on those that I touch when I take good care of myself, it's very empowering because we often talk about filling our cup, then we can help others. But what if filling our cup is exactly the thing that helps someone else. And I find those things encouraging and it brings me joy because my meaning's all tied to it. And so it kind of helps me move forward. People can find me easily. I have a website, kellydholder.com. I can be emailed. I'm on Instagram and TikTok, Kelly Holder PhD. That's my handle at Kelly Holder PhD on both those. So, and I'm also on LinkedIn, same name, first name, last name. So I'd love to interact or carry on this conversation with anyone who might want to continue to talk about these things.
Okay, fantastic. And Sarah will also have you I'll add to the show notes how our listeners can get in touch with you and also what brings you joy. And I just want to thank you again for being my guest. And I would like to say in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.